This video will demonstrate the proper way to remove a helmet from an injured football player. The first provider kneels or lies above the patient's head and provides manual inline stabilization of the patient's head and neck by holding onto the outside of the helmet. The second provider will remove any straps securing the helmet.
Take the straps off. I'm going to hold your head, okay?
Okay.
Once the straps have been released, the internal ear pads of the helmet will need to be removed. This is accomplished by using a thin bladed item such as a bite stick and inserting the tapered end of the device between the helmet and ear pad. Once in place, the device can be twisted slightly to release the snaps holding the ear pad in place. This procedure will need to be repeated for the other side. After the ear pads have been removed, the second provider will place one hand under the patient's posterior upper neck and lower head, occiput region. Their forearm should rest on the ground for additional support. Their second hand will be placed under the patient's chin and mandible to help stabilize the head and neck. Once in place, the second provider will inform the first provider they are ready to assume stabilization of the patient's head and neck. The first provider can now remove the helmet by using slow, deliberate up and down rocking motions. Once the helmet has been removed, the first provider can place padding or buttress material under the patient's head to maintain neutral alignment. After placement of the padding, the first provider takes over the manual stabilization so the second provider can measure for and apply a cervical collar.